Hello everyone, this is Dr. Donald John Babu. Today I'm going to talk about rehabilitation post-surgery. Rehabilitation is the process of getting back to normal life, your normal routine through training and exercise after a period of illness. Here I have posted a video where a lady will be showing you post-surgery rehabilitation exercises for breast cancer surgery and head and neck surgery. The breast cancer surgery rehabilitation exercises involve mainly the shoulder joint, the movement of the arm and the forearm, because after the surgery, one of the complications is swelling of the arm and the forearm. The rehabilitation of the head and neck exercises involves moving the shoulder, the neck, it could be the flexion, the adduction and the abduction movements, the rotational movements of the shoulder and the neck exercises. So hopefully this video will be helpful to you. Please have a good look at it. Thank you.
Lie down in a comfortable position, relax your shoulders and place your hands on your lower stomach. Breathe in and feel your stomach rise. And while breathing out, pull your stomach in. Again, breathe in and feel your stomach rise. While exhaling, try and pull your stomach in towards the floor and repeat. Breathe in and breathe out and feel the abdomen contract. Stand in a comfortable position facing a wall. Raise your hands to shoulder level such that the fingers touch the wall. Slowly walk your fingers up the wall, trying to keep your hand as straight as possible. Try as far as you can go up comfortably without feeling pain. Feel a mild stretch. Hold for as long as comfortable and then slowly walk your fingers back down the wall till you reach shoulder level. Again, walk your fingers slowly up the wall, ensuring the hands are as straight as possible. Reach as high as you can without feeling pain. Feel a mild stretch. Hold for as long as comfortable and then gently, slowly walk your fingers back to the starting position and relax. Remember to breathe normally during the exercise. Stand in a comfortable position with your side facing the wall. Raise your hands to your shoulder level such that the fingers touch the wall. Keep your hands as straight as possible and slowly walk your fingers up the wall. Try going as far as possible comfortably without pain. Feel a mild stretch. Hold for as long as comfortable and then slowly walk your fingers back down the wall till you reach shoulder level. Do this slowly and comfortably. Make sure you're steady and stable throughout the exercise. Again, walk your fingers up the wall, trying to keep your hands as straight as possible. Try going as up as comfortable. Feel a mild stretch and hold for as long as you can, and then slowly walk your fingers back to the starting position. Lie down in a comfortable position with your knees bent. Breathe deeply and slowly. Relax your shoulders and stay in this relaxed position for a few breaths. Now slowly lift your hands and join them together such that the elbows are straight, and gently take them up as far as comfortable without pain. Feel a mild stretch and hold in this position for 5 to 10 counts. Slowly bring your hands back to the sides and repeat. Bring your hands together, get them as straight as possible, take them up, stretch, hold, and release. Stand in a relaxed position and move your hands to the sides. Lift them up and take them behind. Gently stretch, hold for as long as comfortable, and release. Again, take your hands up on the sides, then take them behind and stretch gently. Release and come back. Lift your hands, take them behind, stretch as far as there is no pain, hold and release. Stand in a comfortable position and breathe normally. Now slowly raise your hands and place them behind your ears. Gently move your elbows behind and feel a stretch. Hold as long as comfortable and come back. Again, move your elbows behind and come back. Feel a gentle stretch but no pain and release. Sit in a comfortable cross-legged position with your back straight. Breathe in slowly and deeply. Feel the air fill your lungs. Hold for a few seconds and then exhale through your mouth. Again, take a nice deep breath in. Fill your lungs. Hold for a few seconds and then exhale through your mouth. This deep breathing can be practiced at any time of the day for a few minutes. Stand in a comfortable position, relax your body and breathe normally. Slowly bend your hands at the elbow with the fingers on your shoulders and take them out by your sides. Lift the elbows as up as possible and get them down. Move up and down. Move up again and down. Now slowly get your elbows in front and relax. Stand in a comfortable position with your feet hip width apart. Relax your upper body and breathe normally. Slowly raise your shoulders till your ears and lower them down. Move your shoulders up and down.